All right. Hey, thank you for that introduction. Good afternoon, listeners. You're locked into WVOE, the voice of Ebony, where your heart is our health beat. I'm your host, Dr. Christopher Brown, president and founder of Pressure MD Academy, welcoming you to another enriching session of Health Facts, the show where wisdom meets wellness and knowledge is always in season. All right. So today, let's say, look, welcome to the month of July. So welcome to the month of July. So July is packed with a lot of health observances. There's Healthy Vision Month, Minority Mental Health Awareness Month, and UV Safety Awareness Month. But today, we're going to do something a little different. I like to mix it up every now and then. Okay. What we're going to do today is we're gonna pull back the curtain and show you a tool that medical professionals use to learn and adapt. This is one of the tools that we use in order to not only teach ourselves, teach our trainees, and honestly, even whenever we're out in practice, it helps us to, this is what we use to kind of teach ourselves. When things get a little strange, we'll actually use this tool to solicit the opinions or get the opinions of other professionals that may be within our practice or maybe outside of our practice. And this tool is called a case report. Okay. And what we do is we kind of give a little bit of a story about an individual patient's journey. And we use that to kind of teach each other to get the opinions of other clinicians and to kind of go forward from there. Okay. And sometimes by sharing these stories, we can learn valuable lessons. And like I said, we can get other people's opinion, which, in medicine is always great because, of course, every patient is different. And it's the same way every patient is different, and the same way every health professional is different. So every doctor is different. A good friend of mine used to say, every mother's got their own cookie recipe. So every doctor's got their own, recipe for how they approach things. So like I said, we use a case report to get a lot of different opinions about that. And so we're going to use a case report in health transformation. On this show, we've talked a lot about, preventive care and, things you can do. Of course, we're always educating you about these different health issues that come about. And today we're going to use a kind of a case study to talk about an individual that actually utilized this to their own benefit. And I'm hoping that you'll get a little something out of this and you kind of understand kind of what we've been talking about and what we will continue to talk about and continue to educate about. Okay. And so this story is kind of it's a remarkable, I call it a remarkable story because the guy actually kind of surprised me. I've seen it happen before, but not quite as quick. And it's a story of transformation, really, the ultimate and what, what we like to see with lifestyle changes. Somebody that actually used this thing and say, um, I'm gonna just use a quote. When I asked the guy, he said, I just did what you said." Okay. And so about 4 months ago, this gentleman, he was about 35 years old, African American man, came to our clinic to kind of establish care, just kind of wanted his numbers checked and things of this nature. Kind of heard, in the community that that he needed, to get an evaluation. And so it kind of looked. He's actually someone that I knew actually referred him to the clinic, so he kind of came in. He's basically looking to establish care and just kind of get his numbers done and kind of get his work up. Okay. So and kind of as I'm talking to him, he said, yeah, someone told me I had high blood pressure before, but nothing really was major. And so when we saw him the first time, this guy had significant hypertension. I mean, his blood pressure was 152 over 110. Okay. We talked before about these numbers. I mean, 152 is already high, but like that 110, you know, that bottom number is what the top number should be. So this guy had some super elevated blood pressure and we're just kind of walking around. He had no complaints. He had no concerns. Just someone told him, hey, you need to get his numbers and stuff checked. We found out that he had an elevated BMI. So his BMI was what we called 34, which puts him in an obese category. So we got that going on. And, that was kind of our initial session. We found that in the initial session, ordered some labs and had a follow up. Next time we followed up, go through his labs, found out that the guy has some pre-diabetes, and so not done was not diagnosed with diabetes, but had what we call pre-diabetes. So his labs are um, kind of showing that that he's really at risk. I mean, and pre-diabetes is when you're kind of on that marker, but you just haven't crossed that line yet. His cholesterol was a little elevated as well. And so with all of this, kind of I mentioned before about lifestyle during this first visit about a little bit about lifestyle medicine. And at this point in time, and actually that first visit, we also started most of blood pressure medication. Coming back the second time, we go over we go over his labs, go over his results. Blood pressure is getting a little bit better, but it's still elevated. So, he was at a point where, I talked to him like, look, you got a number of things here that, could warrant medications. Well, he didn't want medication. He really was kind of resistant. He was willing to take the blood pressure medication, but he really wanted it to kind of come out of it. And so had a little bit more conversation around lifestyle medicine. Talked to him a little bit before about changing the diet, whole food, plant predominant diet, exercising a little bit more, and he started exercising a little bit more. And then also introduced the idea of intermittent fasting, where and this is a concept where you basically restrict your eating between certain hours. So like 12 and 8, 12 and 7, and 11 and 6, whatever the time period is. And, I gave him the choice. I was like, hey, look, right now you do need another blood pressure medication or get this under control. We're going to hold off on medication for, the pre-diabetes and the cholesterol, at least for right now. And he really was interested in the intermittent fasting. He said, yeah, I think I can do that. And so, about 6 weeks later, he comes back for his visit. And as I'm talking to him, he states that, hey, yeah, anything going on? I'm like, not really, other than, I kind of stopped the medication. And the first thing I'm like, oh my gosh, stop the medication. Geez. Like, why you stop the medication? Like, well, my blood pressure was running what I thought was kind of low. Like that top number was getting down into the 90s. But that's a little odd for, somebody that needed two medications to all of a sudden need to drop down to just to need to stop, that stop taking the meds. Okay, so 90, okay. Yeah, so I just I kind of cut back and held because I thought that might be a little concern. Okay, so fast forward, we go ahead and get his vitals, and I find out that his blood pressure was actually really good. His blood pressure was 111 over 79. It's got me scratching my head because I had to check the blood pressure several times because I'm like, yo, see, how long will you take? I stopped taking meds about 5 days ago. Huh. And the blood pressure only went this high. It's kind of interesting. So we get the rest of the vitals. Come to find out, he had lost about 19 pounds just over the course of about 6 weeks. And I'm puzzled. I'm like, oh my gosh, what happened? What did you do? He said, I just did what you said. Like, what do you mean? So I did the intermittent fasting. I cut back. I pretty much only eat one meal a day. And when I get hungry other times, I just get a little bit of fruit. And so the only thing we had was that, the only thing we could find was that this is the main intervention that he had. So whenever he left the clinic, I said, hey, look, I still want you to hold on to this blood pressure medication. If that top number goes above 120, you take the pill. Um, and if it doesn't, like I said, by the time you come back in next time, you may not need this medication. I think you may have found that the cure or resolved a lot of the issue that you have. And so that's where we kind of left it. So we'll see how he does between the next time. And so there are a couple of takeaways that, that we can learn from this particular um, this particular case. And so, what lesson number one is your lifestyle is powerful medicine. Your lifestyle is powerful medicine. We've covered this issue before. Chronic disease, a lot of chronic disease in the US is driven by our lifestyle, lack of exercise, poor diet, don't sleep well, lots of stress. You know, this patient achieved more with diet and fasting than with multiple medications. So never underestimate the impact of your daily habits on your health. Okay. So, So that's one. Lifestyle can be a powerful medicine. Number two, small hinges swing big doors. His core change was simple. He was eating one meal a day, snacking on fruit. You don't always need a complex, overwhelming plan to see significant results. Now, for him, honestly, most people can't get most people it takes a while before they can get away with one meal. They have to really kind of get themselves into it. But I honestly was quite impressed. He did that. He started increasing exertion and lost a significant amount of weight over a short period of time. Honestly, I usually recommend no more than about 2 pounds, 1 to 2 pounds a week, and he clearly had kind of exceeded that, but really hadn't changed anything outside of this diet. And one other thing that I forgot to mention, and that is he also stopped drinking. He apparently he was he didn't tell me initially, but I guess he was drinking alcohol on a pretty much a daily basis, and he cut that out. Alcohol is empty calories. That's plenty of empty calories. So to cut that out, to change his diet to a healthier diet, and then, like I said, kind of doing the intermittent fasting, all this kind of contributed to this weight loss. And the weight loss contributed, and from everything I can say right now, the weight loss contributed to the changes in his blood pressure. Okay. Uh, Number three, patient engagement is the secret ingredient. So the turning point for this was the patient's active participation. Between the first and second time I saw him, I mean, we talked a little bit, but really, I don't think he really saw it until I said, "Hey, we gotta get the second medication. And by the way, based off your labs, you actually need, a few more." And I think at that point in time, he really got engaged in his health and decided to really kind of work on. He just honestly he just didn't want to take the meds. Honestly, look, I'll do whatever I got to do, but not take the meds. And I think that really kind of focused him, and he started making those changes. The other thing is this, and that is, and this is the other thing I like about him. He took his blood pressure home. Now, for me, I would have rather him told me that his blood pressure was that low. So I could have said stop it, but like I said, at the end of the day, he was taking blood pressure home and being active inside of his healthcare. So that was huge. Number four, listen to his body and his doctor. He was monitoring his blood pressure, muscle was getting too low, and sought medical advice. Well, he kind of made his own changes. Ideally, you would want to reach out and at least let your doctor know that you're making the changes. Okay. But self-monitoring is key to managing a lot of chronic conditions, whether it's hypertension, whether it's diabetes. All of these things are are improved with and making self-monitoring and being active inside of your healthcare. Next, medication is a tool. It's not your all. Medications can be life-saving and necessary, but they often work best when combined with lifestyle changes. One of the things that we do for high blood pressure, we actually give you a medication that kind of helps you pee out your salt and extra water. There are people that will increase the amount. It's called a diuretic. Will increase their diuretic. There are some people that will out eat what that diuretic can do. So they'll still be swelling. They might improve at first and they get worse. And we come to find out they just continuing to eat, salt laden food, lots of extra liquids, and they literally out eat what the medication can work on. So while medication can be life saving and necessary, they do work best when combined with lifestyle changes. That's just how that works. Um, so we got that going on. And in addition to that, let's see, let's go to our next one. You want to find what resonates with you. Uh, there were a number of strategies that were discussed with him. Intermittent fasting, for whatever reason, intermittent fasting was the one that really kind of clicked for him. I mean, he just really kind of opened up even when mentioning that. So he liked that one. He decided to execute, and like I said, the results kind of speak for themselves. And now the next one's number seven, success breeds motivation. So now I mean, he's really motivated now. I mean, he's got that initial weight loss. His BMI is coming down. I think he went from 34 down to 32. So he's on the way. So I think that now that he's successful, he seems to be very motivated to kind of continue this path. And hopefully we'll see, we'll see with the next time he follows up, whether that A1C has gotten better. I suspect it would have, whether or not the cholesterol results have gotten better. We'll see what goes on with that and kind of go from there. Okay. And number eight, help with more of the numbers. While so his blood pressure dropped pretty significantly. and the weight was a lot more than I was anticipating. He said he felt better. Okay, so he said he felt better. So at the end of the day, like I said, if you feel better, like I said, you feel better. So even though those numbers kind of went a little bit faster than I like, and like I said, of course, nobody likes that top number in the 90s unless you have symptoms. I mean, if you don't have symptoms, it's good to go. So his health is more than his numbers. Nine, consistency over perfection. The patient adopted a new routine. He stuck with it. I mean, clearly he did exactly what he's supposed to do, and like I said, really kind of improved that. And he's complaining a little bit. He said he had a second meal the day before, and he thinks otherwise he'd have been an additional pound down. But I was like, okay, it's perfectly fine, and a cheat meal at this point is not gonna hurt. Just try to make sure it's a healthy meal. Okay, gotcha. And then finally, that doctor-patient partnership is key. So the success were born from open conversation and shared decision making. Okay. So the number one thing is he came in and was open to listening to what was going on, engaged in the conversation, took charge of his health. And this is all these things kind of contributed to this guy being in a better state today than he was 6 weeks ago. Okay. So that partnership is key. So I always want to tell people, make sure you communicate. If you can't, if you want the people that get to the doctor, get a little nervous before you come in, write down the issues that you have, bring them in, engage in conversation, and you can have a better outcome as well. Okay. So, while your doctor can provide the map, you're the one driving. This is your car. This is your body. This is your car. Okay. So we can lay out a map. We can tell you where, what to do, things of nature. But at the end of the day, you're the one driving the car. This is your body, your life. If you want to fix it, like I said, hey, you got to, when you have a car, you go to a mechanic. Mechanic tells you what to do. Mechanic can do, in a car, the mechanic can actually make changes or whatever. But in this case, you're the one that has to make the change. You're the one that has to drive the car. So you work together. You can find the best route to health for you. So this is Dr. Brown, WVOE and Pressure MD Academy, signing off for another session of Health Facts. Hopefully you enjoyed this. Hopefully this inspires someone to go out there and, number one, get your primary care clinician, or at least get a good, solid, comprehensive physical. And when you get those results, to engage in your health and make sure that you're trying to make yourself as healthy as you can be. So thank you very much for this session, and we will see you again next week.